Hey guys, let's jump on in and talk about exercise in regards to people who have had cancer, have cancer, and are recovering from cancer and need to get exercise as a portion of their life to help them increase their healing rate, improve their ability to function in everyday life. We're going to jump right on into it. So let me share my screen and we'll get rolling. The quicker I get through this stuff, the shorter it'll be for you guys. But I still want to share this information and give you the opportunity to get the most out of this. So here is the PowerPoint. Like I say, it's for exercise for people recovering from cancer. Just some stats here from the introduction page. About 1/2 of all men, a little over 1/3 of all women will get some form of cancer during their lifetime. More than 1,500 people a day die of cancer for a total of 565,000 deaths each year. That's just crazy to me. Cancer is the second most common cause of death in the U.S., surpassed by only what? Cardiovascular disease, as I'm sure you all would have guessed for that answer. There's a combination of risk factor identification, new early detection methods, and advances in therapy that's making the prognosis for cancer victims much better than it was, just as it is for infants that are born very prematurely. Years ago, they didn't really have much of a chance. These days, they can be born very early and still make it because of the leaps and bounds that we've taken technologically as far as caring for these individuals. So what this means by the fact that the prognosis is so much better, we're going to have a growing number of cancer victims that will be growing older, living longer, and living into old age, and they would benefit from health promotion efforts and lifestyle changes. And these are the type things that we'll talk about today in regards to their programming. So first, if we're going to talk about cancer, let's talk about, like we've done in every chapter, kind of what is cancer and what's happening when this is going on. Normal body cells, someone who non-cancerous, they're the basic structural and functional units of the body. They congregate together to form tissues. So cells are small, they come together, they form tissues. The body is composed of nearly 70 trillion cells. The basic cell structure, you may remember this from 7th grade science. You've got a cell membrane built to keep things in that are supposed to be in, keep things out that are supposed to be out. A nucleus, which is the center, and then there's cytoplasm, which is kind of the filling in there in between. Cell membrane, it's the outer boundary, separates intracellular components, things that are inside the cell, from extracellular fluid, things that are outside of the cell, just like we said. It's a selective barrier. A lot of times there's things that need to travel in and out. So the cell membrane regulates that movement in and out of the cell. Cytoplasm, it consists of two different things, cytosol and organelles. Cytosol is the liquid, but it's viscous, which means it's kind of thick, syrupy, oily portion. It contains dissolved substances and is a site of many chemical reactions. Organelles are the specialized structures within the cytoplasm that facilitate specific activities. These organelles might even have membranes that isolate them from their surroundings. The nucleus is the control center of the cell, kind of like the name sounds, the nucleus. It contains DNA. It's double-stranded molecules that contain all the genes. We all know what the DNA looks like. It's composed of nucleotides. So there's levels of organization in our bodies, and just like almost anything, the body is arranged from simple to complex. The simplest level is the chemical level. All the remaining levels are based on the lowest level. So problems arising in the lowest level are going to cause issues in the more complex levels. So that's something to remember. If you have issues in your simplest level, then it's going to affect a lot of things because that's the simplest level. So what is cancer? It's not a single disease. It includes hundreds of different types of that are distinguished on the basis of the site of origin, the types of cells they affect. Cancer can originate almost anywhere from just about any body cell. By definition, cancer is malignant, and you need to know what malignant means. Malignancy is the ability to spread to other parts of the body, invade and destroy tissues. Cancer can also easily metastasize to other organs. That means spread, basically. You need to know metastasize. You need to know malignant from this slide. So there's major categories of cancer. You've got carcinomas, sarcomas, lymphomas, and leukemia. It should rhyme too, like it should be leukoma. But anyway, that's beside the point. We'll talk about these. Carcinomas. Some example of carcinomas are lung cancer, breast cancer, prostate, stomach, colon. Carcinomas also affect epithelial cells that line external or internal body surfaces. So carcinomas can be on the skin. Sarcomas develop in soft tissues. They include muscle and connective tissues such as bone, adipose, or fat, and cartilage. That's where your sarcomas will be found or originating. Lymphomas, as you can guess, are going to occur in lymphatic organs. They'll be seen in lymph nodes, the spleen. They affect the immune system. And then there's further classifications made for lymphomas. It can be classified as Hodgkin's lymphoma, which is most common, or non-Hodgkin's lymphoma. Leukemia, it's a blood cancer. Basically, it affects immature blood cells as they form in the red bone marrow. There's different types of leukemia that exist, but they're all characterized by the same thing, the rapid growth of white blood cells. Carcinogenesis, what is that? It's the formation of cancer caused by inherited genetic mutations or mutations from exposure from carcinogens such as cigarette smoking, heavy drinking, environmental issues if you work in a plant that has dangerous chemicals. You see things for Roundup, weed killer. It has carcinogens in there, and saying, you know, you've got Corey B. Trott, you can call me if you've worked with pesticides and now you've got mesothelioma. Basically, that's things that are talking about exposure to carcinogens. It characteristically develops slowly and often goes undetected for years. Now, that's a problem with cancer, is that a lot of the time it develops so slowly. You may feel a little different, but you can just talk yourself out of it being anything. So you have years of undetection going on. And so during this time, you've got cancer cell growth that's outpacing your normal cell growth. And before you know it, when you go for your checkup, you've got more cancer in you than you would ever guess because you didn't even know you had anything going on. Cancer is a scary thing. So here is a nice little table that has contributing factors to the development of cancer. Nearly 10% of all cancers have a heredity component. Age, cancer risk begins increasing at 40, increases dramatically at 50, and like we talked about carcinogens, it says this is possibly because of the cumulative effects of exposure to environmental carcinogens. Even living in a big city where you're breathing in smog and things like that on a daily basis could be an issue. Things that are in our food are carcinogens. And our environment is a factor. You know, exposure to UV radiation from the sun, you know, can cause skin cancer. Asbestos, we've all heard about that. That's the mesothelioma. Benzene, ionizing radiation from x-rays. X-ray technicians are at risk. Those are all things that can increase the risk for cancer due to your environment. And then these are kind of common sense items, but tobacco use, excessive alcohol use, your diet, and just physical activity can cause cancers to form. They're listed over there to the side. I'm not going to read those to you, but you should look at those. Exposure to certain viruses, and you're starting to see more of this where people are talking about, I see commercials about HPV and having your children vaccinated because HPV, human papillomavirus, is linked to certain cancers as well. So viruses can lead to susceptibility for cancer. Also, certain bacteria can play a role. Helicobacter pylori and Chlamydia trachomatis are thought to slightly increase the risk of stomach cancer and cervical cancer. Something else, and this is something that I've had to kind of fight off myself here, is chronic inflammation of the esophagus from acid reflux. I had a lot of trouble with that at one point and had to be medicated for it because I didn't want that chronic inflammation in my esophagus to form a breakdown and vulnerability to cancer in that area. Chronic inflammation of the urinary bladder and pancreas from parasites, chronic inflammation of the colon from an IBS or inflammatory bowel disease. These are all things that can increase the risk for the mutation of cells, which is basically what's happening when cancer starts. You have some mutation followed by uncontrollable cell proliferation, and then oncogene activation, and we'll talk about that. All of those things I just said lead to cancer development. So oncogenes, what is the role of oncogenes? Proto-oncogenes are genes that code for proteins that promote normal cell division and growth. Okay, they ensure that new cells are available to replace old cells, and the problem is that periodically proto-oncogenes become oncogenes when they mutate. Mutate is a dirty word when we're talking about the body here. At this point, once the proto comes off, oncogenes permit uncontrolled growth. Mutation is present, uncontrolled growth. You're talking about the ingredients for cancer here. So proto-oncogenes are positive. They promote normal cell division and growth. When they mutate, when proto-oncogenes mutate, they turn into oncogenes, which permit uncontrolled growth. And usually cancer cells grow faster than average body cells. The role of tumor suppressor genes, what they do, they control the activity of oncogenes. They code for proteins that inhibit cell division or stimulate apoptosis when the rate of new cell formation exceeds the need. So it picks up on the fact that, whoa, there's a lot of cells being added here. These cells are kind of weird. The problem is they cause problems when they mutate as well. Mutation is a dirty word when it comes to the body for the most part. So these are two words that you need to know the definition of. You need to know the difference. Benign tumors, that's what you want. If you're going to have a tumor, you want a benign one. You want it to be non-cancerous, non-threatening growths. It results from excessive local cell division that typically does not spread. So that's what a benign tumor is. It's not normal to have a big lump, but it may be a benign tumor. Malignant tumors, now they're composed of cells that invade healthy tissue. They spread rapidly. They develop elaborate blood vessel networks. These blood vessel networks that are so elaborate, they wrap around things, and it becomes very problematic when surgeons go in and try to rid the body of malignant tumors, because these blood vessel networks a lot of times have infiltrated areas, and they make it difficult to remove everything that they need to remove. Just another tough situation that has to deal with cancer and malignancy. It's characterized by metastasis. So there's some properties of malignant tumors in table 10.2. Aggressive ones, they proliferate and grow without limits. They just go, 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 go. Invasive malignant tumors, they attack, enter, and destroy healthy tissue. Failure to mature, rarely reach a stage where they stop dividing. Like they just keep on dividing and growing and dividing and growing. There's also loss of contact inhibition, where they continue to reproduce even when they contact one another and begin to pile up. Normal cells, when they have contact with other cells, they pick up on that and they stop reproducing or proliferating once they're contacting other cells. So they're not going to pile up like that. Metastasizing, that just basically means that it can spread. It spreads to secondary locations in the body, where at the new location they proliferate, attack, and destroy healthy tissue there. And then it can metastasize from there. And that's the problem, is when people have it start to metastasize in different areas of the body. Here's some of the common causes of cancer in today's society. Tobacco use, heredity, age. We talked about a lot of this already. Someone with an impaired immune system is more likely to get cancer. Exposure to ultraviolet radiation, so skin cancer is becoming more and more prevalent. Exposure to viruses, we already talked about those. An improper diet and lack of physical exertion also leads to cancer. The number one preventable risk factor for cancer is tobacco use, or the cessation of tobacco use. Cigarettes kill more Americans than alcohol, car accidents, suicide, AIDS, homicide, illegal drugs combined. So pretty significant when you look at that. We know kind of what tobacco does. Promotes lung cancer, increases the risk for cancers of the larynx, mouth, throat, esophagus. Those you can think of because that's where the smoke and all is going in and out. Another thing, it also increases chance of cancer in the bladder. Oh, excuse me. Pancreas, stomach, cervix, and kidneys. That's kind of a, where does that come from? But it's just all in how the body, the kidneys and bladder have to do with the body getting rid of things that we don't need. So buildups of things that we bring in from tobacco is being tried to be expelled using the kidneys and the bladder, and that's a big part of what's happening there. Tobacco use also increases the risk for heart disease, stroke, COPD or emphysema, chronic obstructive pulmonary disorders, aneurysms, gum disease, bone deterioration, and eye disease. And there's more than 4,000 chemicals found in cigarettes. And that is insane for something that is that big. That's a lot of chemicals to put in one item. Kind of crazy. This is also, this is almost a comical picture here. Just showing some of the ingredients found in a cigarette. We've got the same thing that's released from car exhaust fumes. We've got things that are used to make tires, plastics, and rubber. Formaldehyde, used to preserve dead bodies. Ammonia, which we know is in cleaning fluids. Hydrazine is an actual chemical that's found in rocket fuel. Hydrogen cyanide, a poison that kills ants. Arsenic, rat poison. Methanol, used in rocket fuel. Nicotine, it's addictive. It increases your heart rate and your blood pressure. And then there's tar, which is used on road surfaces. Cadmium is the metal that is found in batteries. I'm not trying to preach. I smoked cigarettes at one point in my life. Most people try it. Somewhere along the line, I decided I was done, and the day I was done, I was done. Anyway, lots of bad stuff in them. So if you can kick it, kick it. You'll be glad you did. We talked about this stuff already also. As far as heredity, the ones that are the most types of cancers that are most prevalent due to heredity are breast cancer, if it runs in the family, colon, stomach, prostate, cervical, and ovarian. If you've got that family history, you've got to really watch those particular types of cancers. Now, not everybody who has family history is going to develop cancer, obviously. Age, more than 75% of all cases of cancer occur in people over age 55. People with weakened immune systems. What that does, it allows cancerous cells to continue to grow without interruption. Your immune system doesn't step in and try to curb what's going on. And excessive exposure to UV radiation from the sun increases the risk for skin cancer. We talked about this again. They're kind of doubling back on these slides. Exposure to viruses like HPV, hepatitis C, hepatitis B, and Epstein-Barr virus. Those are all viruses that can lead to cancer. In some cases, the virus carries the gene that creates the oncogene once inside the host cell. In other cases, the virus stimulates a proto-oncogene in the invaded cell. As far as diet and lack of exercise, about 1/3 of all cancer deaths are related to poor diet and a sedentary lifestyle in adulthood. So these are the early warning signs of cancer: unexplained fatigue or muscle weakness, unusual weight loss, persistent headache or pain that doesn't go away, changes in bowel movements or urinary habits, a persistent cough or hoarseness, feeling depressed, sores or wounds that won't heal, unusual bleeding, or persistent fever for no other apparent reason. Diagnosis. Developing tumors lots of times don't show any signs or symptoms in the early stages. They're small. Once a tumor is suspected, a physician usually orders medical imaging and medical tests. They'll do things like blood tests to look at the blood count. They'll do x-rays. They may want to do an endoscopy depending on what sort of symptoms you're having. In order to determine malignancy, a biopsy has to be performed. How that happens is you remove and examine cells from the tumor, look at them closely, and see that whether or not it is cancer or non-cancerous. If you have a negative biopsy, it says that the tumor is benign. It can be left alone. It's not going to harm you. If you have a positive biopsy, it says that the tumor is malignant and that removal is imperative. Need to get that out. As far as treatment for malignant tumors, you've got surgery, where they actually go in and take the tumors out. A lot of times, in conjunction with surgery, you may have radiation, chemotherapy, which are other ways to knock down, malignant tumors and prevent spread and things like that. There's also immunotherapy, biological therapy that's being done. It's sort of an all-encompassing wellness approach. Things that they do to boost your immune system to help your body fight off cancer. That's kind of what they're looking for in that particular instance. One moment. Trying to get this phone turned down where it doesn't bug me again. So, when we're talking about treating malignant tumors, for surgery, you're going to remove isolated cancerous cells. It needs to be followed by radiation or chemotherapy because cancer a lot of times metastasizes before growth is detected, so spreads. That's another word for metastasizes. You need to know that. Surgery can often, quote, cure the cancer if malignancy is detected before metastasizing occurs. Now, does surgery always cure cancer? Absolutely not. A lot of times it comes back. Sometimes they cannot get it all. Situations like that. Radiation is another treatment for malignant tumors. What that is the administration of ionizing radiation that's intended to shrink tumors, kill cancerous cells. It's been shown to be effective against cancers of breast, brain, prostate, pancreas, and uterus. Now, there are side effects included with this. It's a risk-reward situation. Generally, the reward will be higher than the risk. Side effects can be skin rashes, nausea, and vomiting. Chemotherapy. You need to know the difference between radiation and chemotherapy. Chemotherapy is a cyclic administration of drug cocktails designed to destroy any rapidly dividing cells. Okay, the problem with what I just said is they're designed to destroy any rapidly dividing cells. Sometimes you have cells that are destroyed that are not cancerous. They just happen to be rapidly dividing. So your body takes a big hit from chemotherapy. It's usually used in cases where cancer has spread into the blood or the lymph. Common side effects with chemotherapy are nausea, vomiting, temporary hair loss, decreased immune functioning, and fatigue. Immunotherapy is relatively new, and it's just an attempt to encourage the immune system to fight off cancerous cells. There's a lot of different protocols. We won't go deep into that, but you just need to know that immunotherapy is pretty new, and you're trying to get the immune system to do some of your fighting for you. So for someone with cancer, if you want to talk about precautions during exercise, if they're going through treatment, they're going to have some fatigue. So there's going to be treatment-associated fatigue. They'll have a lower functional capacity because of chronic pain, nausea, vomiting. You put those things together, your functional capacity will drop. Cachexia, anxiety, depression, and low self-esteem. If you see anything on any of these slides as I go through that you do not recognize, that's what you have a book for. Go through and look. Find out what it is. Google it. Wikipedia it if you have to, although that's not a good place to get your info. Increased risk for infection for people who are getting over cancer. There's also a risk for dehydration that we have to watch for. Some other additional precautions and some things that you wouldn't really think of. You want to avoid chlorinated water if someone is undergoing radiation therapy. So if they're going through radiation, you probably don't want to put them in some sort of aquatic therapy environment. You want to avoid public places like fitness centers for at least a year after a bone marrow transplant. Your immune system is down. You're still building everything back up. You don't want to expose yourself to people and germs any more than you need to. If the patient has an indwelling catheter, they need to avoid swimming pools. Also want to look at avoiding activities that require extreme balance if the patient is experiencing peripheral neuropathies. So we're talking about like numbness, tingling, and things in the hands, feet, lower legs. So if you're needing extreme balance and you have numbness and tingling in the lower legs and feet, that's not going to work out well. So here we are again. What benefits do we see from exercise? Reduced fatigue, reduced incidence of nausea, vomiting, and diarrhea, improved functional capacity, improved psychological functioning and self-esteem, decreased risk of recurrence of cancer for some cancers, a decreased risk for other chronic diseases. So you don't want other diseases piling on top of cancer either. So these are some very good benefits and very strong things that you can use to motivate clients. You know, like, hey, look, we're cutting down on the chance of this stuff coming back. Let's go. As far as exercise testing, you need to obtain medical clearance before testing. People who are dealing with cancer, they will be under medical, supervision for sure. You may need to make adaptations to accommodate limited mobility or impaired functioning that may be resulting from their treatment. Some things you can do is use a graded treadmill or bicycle ergometer test for cardio functioning, a spirometer for pulmonary functioning, dumbbells or resistance machine for muscle strength and endurance, and the modified sit and reach for flexibility. So those are all tests that can be done. Some additional guidelines for exercise: you want to monitor blood pressure and heart rate before, during, and after exercise, if at all possible. Sometimes the during is a little hard. It would be easy to do that prior and after. You want to stop all activity if dizziness, nausea, or chest pain occurs. Make sure that you start slowly. And with patients that are recovering from cancer, you need to build up even more slowly than with the general population. If someone comes in and they have a body temperature over 101 degrees, then you want to avoid exercise also. They're, number one, they're not going to be feeling well. High body temperature makes you feel rough anyway. It's also going to lead to potential dehydration, which you definitely don't want either. If someone has had blood withdrawal or chemotherapy, you don't want to exercise for at least 24 hours after that. Drink plenty of water before, during, and after exercise. Avoid high impact activities if there is any question about bone mass. So to encourage your clients to continue exercise, and that's important because they may not be with you forever, and you want them to continue when they get out of your specific realm. So you want to set realistic short-term and long-term goals. The key word here is realistic to me. Need to be things that they can reach short-term and some things that they can reach long-term. Try to make the workout fun. The more fun a workout is, the more people are going to enjoy it, the more they're going to want to come back and stick with it. Offer extra words of encouragement to build confidence. That can be with any of these special populations that we've talked about, not just for people with cancer. Variety will help to maintain interest. Encouraging activity with family and friends. It makes it a bonding time. It makes it, it gives some accountability. If they've got family and friends that are saying, well, hey, I'm bettering myself too, let's go do this. Using exercise logs to document progress. They've got something concrete in front of them that they can see progress. That's going to be motivating. And encourage client input. If they give you ideas, thoughts about exercising, and you listen to what they're saying and can incorporate that, then they're really going to buy into what you're telling them. So that's something to think about. So contraindications, remember what we talked about that being, those are things that tell us, no, let's not do this. Contraindications to vigorous exercise. Acute onset of nausea after the start of exercise, that you need to stop at that point. Chest pain, decreased heart rate and blood pressure, and blood pressure with an increased workload. That should not be happening. That's the opposite of what should be going on. Irregular pulse during exertion, disorientation and confusion, dizziness or blurred vision, or as we said already, if someone's had intravenous chemotherapy within the past 24 hours, they don't need to do vigorous exercise. Some more contraindications to vigorous exercise when we're talking about people that are recovering from cancer. Leg pain or cramping, bone weakness from long-term use of prednisone, which is a steroid, numbness in the legs or hands, and can you remember what another word for that would be? Neuropathy. Pallor or cyanosis, that's just really not looking good at all, kind of bluish, pale. Difficulty with breathing or shallow breathing. Unusual muscle weakness, or if someone's vomited within the last 24 to 36 hours, you really don't want to jump into vigorous exercise with them either. So here we are again, we're at the sample exercise program. This is where I think it can be the most useful for you when you leave the class, but the least useful as far as testing, because I don't really test you on much of this that has to do with the exercise program, exercise testing, things like that. Those are not my main objectives in this course. A exercise program for this population is similar to the exercise program for the general population. You want to encourage low impact cardio exercise, plan resistance exercises that target the muscles of the chest, back, arms, abdomen, and legs. Be careful with intensity of weights, because when someone is having cancer treatment or just finishing cancer treatment, a lot of times their bones are going to be fragile. So for God's sake, don't load them up with enough weight to break their bones. Simply put. These are important things to know about. There's nutritional considerations that have to do with the formation of cancer and things like that. So if we want to eat to prevent cancer development, we need to know about initiators, promoters, and anti-promoters. Initiators these are factors that have to do with our food that promote cancer development. Initiators, know this. Some examples of initiators are the char that's on grilled meats and vegetables. That's not exactly healthy. Acrylamide, it's found when certain carbohydrate-rich foods are fried or baked at high temperatures. And a lot of times there's cured meats, jerky, things like that, have nitrites that are in them. Those are also initiators, which are factors that promote cancer development. Know what initiators are. Promoters, these are factors that do not form cancer cells, but they encourage the growth of cancerous cells once they're there. Some examples of things that are promoters dealing with nutrition are high calorie diets and diets that are high in saturated fat and high in trans fat. So this is, once you've got cancerous cells there, this type of eating, high kilocalorie diets, high fat diets, are going to encourage the growth of cancerous cells once they're there. Not cool, not a good thing. promoters bad. Even though they don't form cancer, they encourage the growth of it, which is just as bad. Anti-promoters. This is good stuff here. Anti-promoters reduce the risk of cancer development, and some things that nutritionally we can have that are anti-promoters are fruits, vegetables, fatty fish. Those can all be things that are anti-promoters and reduce the risk of cancer development. Here are some foods that might protect against cancer: legumes or beans, berries, cruciferous vegetables, leafy green vegetables, flaxseed, garlic. Garlic also protects against vampires, so that is a plus. As far as nutritional considerations continued, we want to be sure that we eat well after there is a cancer diagnosis. A cancer diagnosis is going to lead to stress. It's going to lead to probably less appetite. However, someone who's going to be fighting cancer, they need good nutrition to fight the good fight. And talking about carbohydrates, which are a big portion, you want to consume enough to provide energy to meet daily demands without weight loss. That's the key. You've received your diagnosis. You want to try not to start losing weight immediately. Include fruits, vegetables, and whole grains. Those are, like we said, example of anti-promoters. Limit intake of simple carbs, which is, that's the stuff that's in boxes, cans, freezer section. That's where your simple carbs are. Candy bars, simple carbohydrates. Ice cream, simple carbohydrates. And you want to increase your intake of fiber. As far as proteins help fight infection. They also help to build tissues, which is a good positive thing too. You can get these proteins from dairy products, lean red meats, poultry, fish, and legumes again, or beans. Fat can be a good thing, the proper types of fat, but overall you want to limit your total fat intake, especially saturated and trans fat intake, but be sure to include plenty of omega-3 fats that come from where? They come from fatty fish primarily. What about alcohol? Alcohol, if you see excessive intake of alcohol, it increases the risk for cancers of the mouth, pharynx, larynx, esophagus, and liver. The American Institute on Cancer Research suggests just avoiding alcohol in general. If alcohol can't be avoided, limit intake to 2 drinks a day for men and 1 drink a day for women. As far as vitamins and minerals, it's best to get adequate amounts of vitamins and minerals through a good diet and through your food. The effects of supplements are not really well defined in this population of people who have received a cancer diagnosis. Water is important, as it is with every single group that we have talked about and will talk about. You want to consume at least 64 ounces of water daily. And if you know that you're going to be sweating or have been sweating, you need to consume additional amount to replace that. So after your treatment ends, you need to continue healthy eating. You can get that from your physician. They can give you advice. They can set you up with a dietitian, something like that. You need to have various foods from all food groups, include at least 5 to 7 servings of fruits and vegetables. Again, this is anti-promoters. Eat whole grains and other high fiber food. High fiber is good. decrease total dietary fat intake, especially limiting saturated and trans fats. Avoid salt-cured, smoked, and pickled foods. That's where we talked about there being nitrites, which can be dangerous. And avoid alcohol if possible. If someone has advanced cancer, we're talking about, cancer that they're probably not going to get over, that they are sick and they're going to continue to get worse. So, sad situation, but you may be faced with this. The goal of the treatment in this situation is going to be to relieve pain, ease fear, and preserve independence. And those things are all very important for someone who has advanced cancer. One thing that's going to be fairly consistent is that patients who do have advanced cancer, they have poor appetite, a lot of nausea and vomiting. They'll see bloating, difficulty swallowing, constipation. All these things make eating kind of undesirable. At this point in the game, all this nutrition stuff that we just talked about can kind of go out the window. You just encourage them to eat anything that's tolerable that they want. If they want to eat cotton candy, you give them cotton candy. Factors that can reduce the risk of cancer. Achieving and maintaining a healthy weight, eating various fruits and vegetables, at least 5 servings a day, consuming 100% whole grain products. You want to limit your intake of red meat and processed meats, choosing fish, poultry, and beans. Limit alcohol intake, participating in at least 20 to 60 minutes of cardiovascular activity 3 to 5 days a week. So activity is a bonus, is a plus as well when we're trying to reduce the risk of getting cancer. And you can read this one on your own. I'm going to stop the share. That was a good chapter. It had a lot of information about cancer in general. I tried to name the things that are going to be the most important for you guys when it comes time for testing and such. So try to make it a point to take notes when you watch these things. Again, I don't have a ton of you showing up as watching them right now, but you're missing out. And if you want to do well, you need to be checking these things out. So hopefully the one that needs to hear this will hear it. Hope things are going well during this crazy semester, and I'll be back with the next one soon. Thanks, guys.